All right, so this is for the cardiovascular system, things that I feel that you guys should know. So number one, the receiving chambers of the heart are called blank. Number two, the discharging chambers of the heart are called blank. Number three, on the left side of the heart, you will find the largest blank, which pumps blood through the aortic semilunar valve and aorta. Number four, the right blank pumps blood through the blank valve, then into the right blank, which then pumps blood through the blank artery. Number five, the pulmonary semilunar valve is located on the blank side of the heart. Number six, the left atria receives oxygenated blood from the blank veins, which come from the lungs. Hint, hint. Number seven, the blank is the layer of the heart wall that is found in the innermost aspect of all three layers. Number eight, the blank is the actual pump of the heart, and it is the thickest on the blank ventricle. Number nine, the blank arteries supply the myocardium with oxygenated blood. Number 10, the blank and blank vena cava or vena cava collect the oxygenated blood from the upper and lower parts of the body. Number 11, arteries have blank pressure when compared to veins. Veins have one-way valves and transport blank to the heart. The arteries transport blood blank from the heart. So we're talking about directions here. Number 13, the sympathetic nervous system, blank heart rate and vaso blank. Number 14, the parasympathetic nervous system, blank the heart rate and vaso blank. All right, now application. So the idea is that all the topics that we just discussed, or the items that we just discussed, were more like content-based. This is more about placing them into the application and how it works. So number one, the right side of the heart, when the right side of the heart fails, the blood backs up into the blank. When the left side of the heart fails, the blood backs up into the blank. Number three, the ideal position for a client with left-sided heart failure is blank, blank. Number four, when a patient is experiencing intermittent claudication, which we probably have to look up if you don't know it, the extremity should be positioned in a or an blank position. This is to maximize perfusion. Number five, a patient who develops darker pigmentation and edema of the lower leg would be known to have a blank insufficiency issue and should place the extremity in a and blank position. Number six, a patient with right ventricular failure would demonstrate fluid retention towards the blank and blank vena cava. Both superior and number seven, both superior and inferior blank drain blood from the superior and inferior parts of the body, respectively. Number eight, the inferior vena cava receives blood from the blank through the hepatic vein and superior vena cava. And the superior vena cava receives blood from the central veins, which receive blood from the blank veins. Number nine, atherosclerosis contributes to blank, which is defined by lack of perfusion to the tissue, attacks, also known as blank blank, most commonly occurring in the legs. Keep in mind that some of these terms, I've used them already in the prior numbers, so just make sure that you guys pay attention to that. Number 10, peripheral artery disease, blank blood pressure. To lower blood pressure, the blood vessels must blank. That is what antihypertensive drugs do, for the most part. Diuretics just get rid of fluids. Number 12, narrowing of the blood vessels or constricting of the blood vessels contributes to blank blood pressure. Number 13, activation of the sympathetic nervous system will potentially cause blank. These are usually benign rhythms. Number 14, cardiac patients should prevent blank by increasing fiber in their diets. Straining stimulates the blank nervous system and decreases heart rate and lowers blood pressure, which is something that you don't want to do to any post-cardiac operative patient.